Lesson 4, we're going to talk about setting up providers and patients. So before a provider can file a claim for their visit or their encounter with a patient, there's certain authorizations that have to be obtained and certain information that has to be collected. First of all, the provider has to be credentialed with the insurance payer, and usually there are several payers or insurance companies. The provider must be enrolled with the payer to send claims electronically. This is usually done through the clearinghouse. They have an enrollment process and enrollment forms there. And then patient personal information has to be collected, and that's usually done on the first visit. The patient insurance information, which is critical, has to be collected, and that usually involves making a copy of the patient insurance card. And then the provider must have the patient's authorization to submit claims on their behalf. Now, once this information is all collected, the patient information, the provider information, and the visit information or the encounter information, that's entered into the practice management software. And there are hundreds available, so many that if you ever try to look for one, you'll be overwhelmed. But many times practice management software and medical billing software are terms used interchangeably, but typically a practice management software is the most common software used, and it has several capabilities: scheduling patient visits, managing patient accounts, creating and filing insurance claims, recording the patient insurance information and patient payments, and also recording and tracking insurance payments, creating patient statements, and tracking claim status. Some practice management software also has integration with electronic health records software and also clearinghouse software, but there are a wide variety of practice management software applications available. Here's a screenshot for our examples that we've taken from the fundamentals course, but it shows where the provider information is entered in the practice management software. In this case, we're using PracticeMate from Office Ally as an example. And this is where all the critical information for a provider is entered into the practice management software when you're first setting up the provider. And this is only done one time, but this gives you an idea of the type of information and what it looks like in a typical practice management software. The CMS 1500 claim form, this is probably the most important form in both its paper and electronic form in medical billing, and it's a very efficient form. It includes both the patient demographic information, the patient insurance information, the provider information, and also the visit or the encounter information, which encompasses pretty much the treatment and diagnosis codes for the patient visit. It's very recognizable when you see it in its paper form by its red ink, distinct red ink. I show it here in its paper form, but over 95% of claims are sent electronically, and if you were to look at the electronic claim, it would be laid out exactly like this. And many times you can view it in the practice management or the clearinghouse, and it looks just like this. The fields are the same. This form is maintained by the National Uniform Claim Committee, who developed this form and are responsible for the standardized instructions for the CMS 1500. A few other important forms in medical billing. The super bill is very important, and it's you've probably seen one of these before. It's customized for each practice, and the practice management software will typically allow you to customize and make as many super bills as you need, and it allows you to add the commonly used treatment and diagnosis codes and any other notation. But this form is commonly used by the medical billing specialist to enter the diagnosis and treatment codes and the modifiers into the practice management software to document the patient visit so that a claim can be created. Another very important form is the patient information form, because that is where the patient demographic information and also the insurance information is collected. This information is collected, of course, at the first visit. It's entered into the practice management software only once, but it's very important that this information be correct and up to date. And if there's any changes in the patient's insurance, that information would need to be updated in the practice management software. There are many other forms that are filled out, especially on the first visit by patient. We include those forms and all the templates in our fundamentals course. Here's a copy of the typical patient insurance cards that include the very critical information, of course, the insured name, the insurance ID, any group numbers, any contact numbers for the insurance carrier, and any other specific or unique information for the insurance payer. And I've shown an example here of a Medicare card. That's typically what they'll look like. And a Blue Cross Blue Shield card, they'll look something like this. Very similar. They vary somewhat. And a lot of the commercial insurance cards will look very similar to these. But they're usually pocket wallet type cards with very critical information that typically you will copy these and scan these on the first visit by the patient. Here's a screenshot, again in the practice management software, where the patient information is entered at the first visit and updated as necessary if any of it changes. This is the patient demographics information screen. It shows where all the patient name, address, their contact information, and also you'll see an insurance tab there. That's where the insurance information is entered in the practice management software. This is a screenshot of the patient encounter screen. It mimics the CMS 1500 form that shows the diagnosis and also the treatment, where those codes would be entered to document the patient visit. And this is out of the same practice management software, but just wanted to give you an idea of what that looks like and how it mimics the CMS 1500 form. So this information for each visit is unique, and it changes. You could have several diagnosis codes and several treatment codes, and we get into those details in the fundamentals course. Some of the other important forms that are required to be filled out on the first patient visit are the patient information form, which we showed a screenshot of that earlier. That includes all the insurance, the demographic information, the guarantor, the assignment of benefits, signature, payment authorization. There's also the authorization for release of medical information, the patient medical history, the PHI acknowledgement form. The PHI stands for Protected Health Information. That's a term that's brought about and you see a lot more often now because of HIPAA. The payment policy of the practice and the HIPAA communication disclosure. So that wraps up Lesson 4 on patient and provider information necessary to file a claim. In the next lesson, Lesson 5, we'll be talking about coding.